are you full-time with adults, with children? Who are you seeing, and what are you focusing on?
Yeah, it's kind of been a variety pack so far. So while I was in residency for a year, I was dealing with a variety of folks doing rotations. So I did a neuropsych rotation, I did health psych, I did regular clinical care. And then when I got to my current duty station, I'm working in what's called a behavioral analysis service. And what we do is evaluate the basic trainees to determine if there's any conditions that they possess that are disqualifiable. And then we also do some quick short session treatment for those that are having some trouble getting through the few weeks of training.
So you've been working in mental health through this pandemic. What are the trends that you're seeing that would be unique post-pandemic, things that didn't exist 3 years ago that you're now seeing in the mental health arena?
Well, one, and it was adjustment for everybody, but the telehealth format. There were some that embraced it before COVID even began, and they were already kind of set up for success. And then others who were sort of resistant the entire time, and they would rather take a sabbatical than to conduct treatment over video. And then there were some that eventually were like, this is the new way. And those are the ones that were the most correct, because even post-pandemic now, you have a lot of mental health providers who have just decided to stay with that format. They've gotten comfortable working from home and having the home office and the tax write-offs that go with it, and not having to commute into an office where they have to pay a fee. So it makes a lot of sense. I'm still on the fence about it. Maybe I'm a little old-fashioned. I need the human contact of my client in the room with me. There's a lot that goes on non-verbally that I can't really obtain over a screen. How we even have apps now where therapy is conducted over audio alone or even by text, to me is just, it's fly-by drive-through therapy, and I wonder how effective that is. Now, what you have is a lot of the younger clients these days, that younger demographic, that actually prefer that format because it's as needed. If they're feeling some kind of emotional upset, they can just jump on their app and send a text, and their provider is going to be on the other end and send a text back. But regularly scheduled, ongoing, regular treatment is, to me, the best effect in order to maintain mental health, not only to ward off elevated emotional distress, but to keep it from returning.
Yeah, I would imagine, again, from an older generation relative to the average age of those serving in the military, that office during session was the safe place. So if there's domestic violence, if there's unsettled mental distress, that the office was the safe place. And are we losing our safe place?
Well, it's debatable. On one hand, you could look at it as the fact that a service member can get their treatment via video from home means that a lot of the stigma is removed, because a lot of their hesitation in going to a clinic is a lot of them are physically situated within hospitals. And they've got to park in the parking lot, go through the lobby of the hospital. Now they're sitting in the waiting area of the mental health clinic amongst fellow patients, and do they know somebody that's sitting there, or are they worried about running into their subordinate or their leader while sitting there? And so there's a lot of hesitation to even get to the door because of those conditions. But on the other hand, you have safety considerations. If somebody's expressing some safety risks, then if they're in an office, you can handle it right there. You could find ways to hold on to them until they can be transported to an inpatient facility if needed. But when they're on video from the comfort of their home with all, potentially, a handgun or other devices that they can harm themselves with, and they disclose to you that they're intending on doing so, it becomes a little murky at that point.
Do you see any trends between the genders, between male, female? Are any differences in preference or situations, diagnoses between the genders?
Diagnoses?
Yeah.
Well, a fault of the mental health field for a while has been that there's almost a discrimination that females are more readily diagnosed with borderline personality disorder than males. They could be presenting the same way, but just because of the underlying impressions we have of the female condition versus the male condition, the female is more likely to be diagnosed borderline, and the male is more likely to be diagnosed with maybe antisocial features or something along those lines. I mean, both of them personality related, certainly, but it's almost like to a certain extent, acting up is sanctioned with the males. Physically acting out in any way. If a male is putting a hole in the wall, you might consider that maybe he's got an anger problem. But if a female puts a hole in the wall, well, what's going on with her? Why is she acting like that? And the same respects, if a man's curled up into a ball in a corner having a crying spell, it looks a lot differently to an outside observer oftentimes than the female doing the same thing.
That's a really interesting piece of data. And that I would imagine that also changes the way each gender's treated in terms of treatment.
Well, I mean, if you're a well-trained practitioner, there's a heavy emphasis on a lot of programs these days, both on the master's and doctoral level, emphasizing diversity and considerations of gender and ethnicity and all that stuff. It really comes into effect a lot more in the past few years than it has in the past. We used to have very templated not only treatment protocols, but the way we assess and conceptualize our clients as well. And it wasn't taking into consideration some of the family of origin issues specific to certain ethnicities and genders. All of that has come into play a lot more in focus now, and it's really woven into a conceptualization of what's going on with a client.
So are you seeing anything out of the ordinary with spouses, dependents, anything that would be of concern this year?
During COVID, it was a real test of relationships and marriages, because you were at the beginning of it, when the quarantine and lockdowns were in effect, you were pretty much cooped up with your partners, and having some sacred space of alone time for some couples was critical. And when you had that taken away, some of those little nuances in behavior, some of those proclivities or habits started to grow on couples. And substance use at the same time also increased. It was a way to pass the time. It was a way to process the stress. We were bombarded with very negative news stories, and it was kind of a way to let it melt all away. And it became habitual for some folks. And when you combine those two things that I just described, we also had an increase of domestic violence. And that was not only against spouses and partners, but also against children in the household, unfortunately.
So what is the outcome of that? What is the military doing to assist with that?
Well, we have a very robust, so we partner, the mental health clinics partner up with family readiness centers, and we partner up with a variety of organizations that coordinate in order to not only treat the victims of domestic violence, but also to make sure that the offenders get proper repercussion.
Wow.
And it's not always, the military member. Sometimes it's the civilian spouse, partner. Yeah.
And you mentioned substance abuse. I'm assuming alcohol, marijuana, but were there other things?
I mean, substance use in general has gotten kind of out of control. We have, of course, the proliferation of over-the-counter combination of pharmaceuticals, right? So people making that, concoction. Sometimes it's teenagers exchanging recipes online. trying to get the best effect. And in some cases, it's easier for them to get those materials than it is for them to, take a beer out of a 7-Eleven. But then there's also the abuse of prescription medications, including psychiatric medications. As we know, the intent when a psychiatrist or a physician prescribes these medications is it's meant to be temporary. It's meant to subdue the negative symptoms so that you can seek talk therapy, ongoing treatment, and be able to work through that treatment without those symptoms becoming too overwhelming. Instead, what we've gone to is a model of quick prescribe and then do it as long as you say you're willing to do it, until you say, I don't want to do this anymore. Very rarely do I see physicians or psychiatrists say, you know what, I think you're doing okay now. Maybe we can taper you off or terminate your medication at this point and see how we do. It's just, it's too easy to keep the patients coming in month after month for their rescript.
And how does that affect the brain to be I'll say over medicated, but to be using drugs inappropriately? How is that going to affect their mental health?
Well, there's some interesting things that we're finding out that are occurring on a neurological level with long-term use of some of these medications. For instance, anti-anxiety medications. The purpose is essentially that you don't get activated by stressful events, right? Yeah. On the surface, that seems like a good thing, but stress in a way is healthy because it can be motivating under the right conditions. If an event is causing you stress, then the motivation is to change the condition so that the stress no longer exists. But if you're relying on medication on a daily basis over the course of decades, you've gotten to the point where your brain is now conditioned to not respond to stress at all. In other words, there's a certain sense of apathy. Mm-hmm. And there's certain areas of your brain that begin to atrophy because they're not being utilized any longer. So it's almost like we get the same kind of condition with marijuana use. Marijuana use, for some, they claim it takes off the edge. But for others, consequentially, if it's used regularly, it just kind of makes you not care about the important things in your life as much.
That's interesting. I do a lot of teaching on the importance of emotions and being able to honor every emotional crayon in the emotional crayon box. And this is something that I would want to dive in more on the impact, the effects of medication on people being able to experience happiness, joy, gratitude, how that would stunt the ability to express those emotions. And I want to talk about anger, if we can stay on the topic. Mm-hmm. In my research, my findings, anger is the first crayon I want to pull from a crayon box when I'm working with people. If they're not able to feel anger, chances are they can't feel other emotions. And are you seeing something similar on your end?
Well, the way I sometimes approach it is anger is the armor that fear wears. And so I might, beat around the edges of the anger on the surface at the beginning, but really what I want to get to is the core, which is that fear. Yeah. Because for instance, when somebody's in a relationship and they've been cheated on and they find out and they confront the partner and there's this intense rage, really that's fear. Whether it's fear that's resurfaced from a past relationship where they were crossed and all of that's coming to the surface again, or fear that their sense of the world and what it means and their relationship to it has now all of a sudden crumbled. But that anger is just a quick response.
Mm-hmm. I want to talk about EMDR. This is something that my audience, I've talked frequently about EMDR and the quantity of the number of sessions required. Because I have a lot of clients, they think, okay, I'm gonna have one session. I'll go to one therapist one time, magic wand, everything's fixed. But that's not reality at all.
It's not like getting a laser treatment to take away the wrinkles.
Sessions are gone.
Yeah, and the unique thing about EMDR is it is a lot more involved than people realize, both on the side of the client, but also on the side of the practitioner. There's a lot of practitioners that haven't embraced EMDR yet because, on the surface, they think it's kind of honky. I'm going to have my clients stare at a beam, fluctuating lights, and going to take away their trauma. What are you talking about? But once you do a workshop and you learn the foundations, you realize that it does work. But even some of those folks, even though they might have spent hundreds of dollars to practice it, it ends up going to the wayside because it is so involved. Even though it's scripted, there are different variations of scripts. There's deviations from the main script. When you're working with a client, it's almost like weaving a basket, because sometimes as you're addressing one trauma, you both agree on what the primary trauma is, because people have complex trauma, of course. And so you agree what the primary trauma is. And once you've gotten that out, you find out what was underneath that rug is a whole bunch of other traumas that now need to be addressed. So you could sell them a package of, okay, we're going to take care of this primary trauma session. We have a special going on Groupon for 10 sessions and you're good to go. But then at the end of that, oh my gosh, we just found 5 more traumas. I'm going to have to charge you a little extra. Imagine if an auto shop did that after they fixed your car and told you there was a few other problems, right? So it's a very, very challenging modality.
So what is your preferred psychotherapeutic modality? What is the one you love offering?
Well, I started out with a passion for psychodynamic orientation.
Tell us about this. This is new to me.
I mean, that's that old school it's an offshoot of the old psychoanalytic Freud stuff. Working with the ego, superego. If you're into it, working with dream analysis, but in the modern world with insurance providers, they don't buy into that, because that is prolonged treatment. These are that modality is these days more suited towards the LA, cappuccino sipping. They're going to therapy because it's trendy and they like to brag about it to their friends rather than they actually need it. Or to people who have gotten through and they're well functioning, they've gotten through a lot of the serious junk in their life, and they really want to deep dive to fine tune things. Some of these high performers, neurotic level functioning, CEOs of corporations, they want to get that performance edge. And so that'd be suitable for them. But the average American these days, CBT is the medicine that they end up consuming, because it's accepted by insurance providers, because it's time limited, and it's focused on the symptoms. Now, there's good and bad to that, right? Because I look at it as like if you have a cut on your arm, and we just wipe away the blood, and that's it. Well, the more blood's going to come to the surface, of course. So it's the same thing with mental health treatment. If we're only dealing with that tough difficulty sleeping, the mood dysregulation, the shaky hands, the negative thinking, obsessive thinking, then those are the symptoms. But we're not getting at why all that came to be in the first place. Why you're functioning badly and your siblings are doing just fine, and you grew up in the same household. That kind of phenomenon. You really have to get under the surface of that material, and sometimes you just don't get to do that with the standard 12, 15 treatments that your insurance provider is able to afford you.
So what is the golden number? Is it, I'm guessing 12 is the low end. What is the golden number for success through the data? What is the research showing?
Well, it's hard to narrow that down to specific research studies, because there's so many variables packed into that. We're talking about, like we just said, which modality you're using, right? What the disorder or the presenting problem is of the clients, and then also the skill level of the practitioner. You could have 2 people that are trained very well in CBT, but the way that they approach it, it's either going to attach very well to the client and they're going to have buy-in, or it's not. If you're going to have a provider that's very manualized and reading off instruction sheets from session to session, then they're not necessarily connecting and customizing the treatment to the client.
I want to go into, I want to talk about things that you're seeing work well, and whether it's military, non-military, what are things that you're seeing, whether it's treatment plans or outside of mental health, alternative things that you're seeing work well, whether it fits in your under your lane in the military, or if it's something outside of the military that can help
Yeah.
people.
Well, the one thing, and I stand by this, is whether it's a military member or a civilian, it's social connectedness.
Huge.
It wards off mental illness in general. It's one of the biggest contributors to preventing suicidality, and it's definitely missing in today's world. And it was bad enough before the pandemic, but now it's even worse. If people felt socially connected, whether it be a church congregation, a next door neighbor, family members, or friends, I'd be out of business.
Yeah, absolutely. Absolutely. So can we dive into that? Because like I've gone in, I've studied the Harvard's adult development, the study on adult development, the like what makes the good life.
Mhm.
And I've looked at the data that was presented by Robert Waldinger in those studies with Harvard over the 80 years now, 90 years now. What else are you seeing? So social involvement, what other elements help people move through tough times or mental health challenges?
I would say probably second underneath social connectedness is a very simple formula of giving equal weight to negative thoughts and emotions as they do to positive ones. You know, it goes back to the root of psychology. We seek to avoid pain, and we're attracted to pleasure and anything that's going to provide it. But we have to give them both equal attention. And the problem is that we look at negative feelings and negative thoughts as very toxic, and we either dismiss them or bury them and not address them entirely. And we only seek those sensations that are going to provide us joy. I can't count how many times I've had clients show up to first session and we're talking about treatment goals. I just want to be happy. Well, to me, that's like they're trying to seek the high of any street drug as a constant. That's impossible. High is on the one end of the spectrum. I mean, happiness is on one end of the spectrum, just as sadness is on the other. And I try to, have a little pep talk with them. And is it okay if what we focus on during the course of our treatment, finding contentment and spending as much time there as we can? Because when you're content, you understand there's going to be those highs, you understand there's going to be those lows, but eventually you'll return back to the center.
Can we swim in this area right now? Because these are simple things that people can
Very
do.
simple.
Super simple. Like, what would be number 3, or what else would be included in this list?
Well, right underneath that, I would have to say conventional psychotherapy. Because if you haven't mastered those two things, if you aren't able to do those on your own for some reason, then there's other material going on under the surface or unconsciously that really needs to be brought out formally, all right, with a professional. Because, for instance, take that social connectedness one. If there's things going on with your personality or things going on with your self-esteem, that's probably deeply rooted into your upbringing or some significant events earlier on in your life. And that became a template for how you relate to the world. That's not going to disappear overnight. You can't read a self-help book and conquer that. You really got to talk it out and peel away the layers of that onion. And then take the second one. If you become easily emotionally dysregulated, you're unable to find that center point again on your own, or it takes you extra long to get there again, then chances are you're being activated by unconscious material from your past that you haven't fully addressed. And even though you might be chewing off your spouse's head at this point in the present, really you're confronting maybe past partners, your father, your mother, people who wronged you in the past, and essentially you're zoning out and you're addressing all of them at once.
Ooh, can we talk about dissociation?
Oh, yes.
Like the different types of dissociation? Because with my clientele, I have Jules is one of my core team members who had DID and no longer has DID. But it doesn't mean that she's not still dissociating in some way. She's just not that extreme on the spectrum. And so my audience is seeing this extreme and saying, well, I'm not that, but not understanding that dissociation is a spectrum, and you can have a little dissociation, and then you can swim in the Olympic pool of dissociation.
Or you could be, you know, a high schooler in class and your teacher notices that you're someplace else, you're daydreaming. That's a form of dissociation. Really, you find the current environment unacceptable or unappealing, and you're taking a mental vacation from it.
Well, where else does this play out? What are some of the other examples you see that would be relevant to like day-to-day life or workplace? Different examples of dissociation.
Well, I mean, it could occur anywhere. Keep in mind, somebody with a classic case of PTSD, they're very sensitive to triggers in their environment that remind them of the original initiating trauma. And that could happen at any point, anywhere they go. Some people with serious cases, for that reason, reduce how often they leave their home, if at all, just to avoid those triggers.
Mm. And what about dissociation while driving or while operating heavy machinery? What would that look like?
Well, first of all, that'd be very dangerous.
Yes, that doesn't mean it doesn't happen.
Yeah, I mean, to an extent, remember, it occurs on a spectrum. To an extent, we all might have done that at some point, where we're driving a familiar path from work to home, and we didn't realize that we made the turns that we did, or somebody says, "Did you see that?" No, I didn't. Wasn't paying attention, right? So sometimes our mind goes into autopilot because it's conditioned to go through a certain routine, and it doesn't feel the need to devote 100% of the cognitive energy to the environment, right? But it becomes dangerous. I haven't seen it personally, where somebody's a crane operator, for instance, and then because of past trauma, they're activated, and then they just kind of let go of the crane, and all of the stuff falls. I haven't had a client with that type of issue, but I have seen it play out in session. And I have seen it play out in unique ways. For instance, way back during one of my initial practicums, there was a female client of mine who had experienced young adulthood trauma from her father. He would sneak into the bedroom in the middle of the night when the rest of the family was asleep. He would molest her, but the bed was sort of in a corner. And so he had access only to the left side of the bed. And so when she was describing this trauma in session, she was tapping quite a bit with her right side and shaking her leg quite a bit with the right side. But it looked like the left side, her hands, her feet, her legs were just dead. They were numb. And I asked her about that. And that's where we kind of find out the layout of the bed. So essentially, she was dissociating only on that half of her body, because when she was being molested, that's the side of her body that was most often experiencing his contact.
Does this sound familiar to some of the members in the TikTok audience right now? How our body responds to the trauma?
Yeah. Another unique thing I saw with trauma too is this is one of the most fascinating cases I saw, was an overweight female. Her presenting problem is she wanted to both lose weight to gain self-esteem, and then also address her childhood sexual trauma. Once again, a father, and they worked on the trauma first because it was the most pressing. And once that was thoroughly addressed, then they worked on self-care, eating plan, diet, and a workout plan. So she started to lose weight. But as she lost weight, some of those trauma symptoms started returning again. And it's like, well, what's going on here? Well, what happened is that when she gained weight in the household when she was young, her father no longer found her attractive. So it actually became a force field. And the more weight she gained, the more he left her alone, to the point where it ceased entirely. So now she was conditioned to look at, I mean, it was conditioned, but it was unconsciously conditioned, because she didn't realize that she was looking at that as a security blanket. So when she was losing weight, she was now becoming more vulnerable again.
Can we talk about safety? This is safety is such an important element in mental health healing. Can we dive into how people can feel more safe, whether it's with their therapist or in their day-to-day life, things they can do if you have simple ways for them to feel a little more safe?
Well, I mean, there's two main realms of safety. One is physical safety, the literal, protection of their body and the violation of it in some way, or from harm or death. And the other is emotional safety. In other words, there is a space being cultivated for them to be able to fully express what they're feeling when they're feeling it, right? And I'd say that the first one is easier to do, because you can make very visible changes to your environment. But knowing whether the person sitting in front of you is fully trustworthy with your deepest and darkest secrets, that is too conceptual to fully grasp. And it's harder to maintain that sense of safety and that trust.
In your academic training, have you done any work in like identifying body responses, so the sort of sympathetic or sympathetic responses, for people to be more aware of when their body does not feel safe?
Oh, absolutely. When you're going through CBT, for instance, there, part of the protocol is the first session or two is mostly it's psychoeducation, telling the client what those reactions in their body are and making them aware of it. That's the important thing is first, before you make change, you bring about awareness. And so that's why that education piece is critical, so that they can understand the warning signs, so that they don't get to the point where they're so disabled and paralyzed that they're not able to remove themselves from the situation they find unsafe.
Can we talk about stress and fear responses, the fight, flight, freeze?
Mm-hmm.
So the common ones are fight, flight, freeze. What would be the secondary responses that you see in your practice?
I would say I've seen all of them pretty equally.
Yeah.
Yeah. It's interesting how they play out, but also there's certain things that are attached to it, like denial. There's a lot of nuance to that. I wouldn't say that of the three, there's one that I see more often across the board.
So I'll backtrack a bit. I focus on the tend and befriend, which was something that was discovered about 20 years ago in a 1999 study, where all the studies historically with high stress CEOs, they were all done on males. They would study on males. And then they did a study on female CEOs only. And they found that females came together, and it's what they call like the coffee and muffins. Like they would come together, eat together, bond together. And that was a successful response to stress with female CEOs. Mm-hmm. So you're probably not working with CEOs, but are you seeing a difference in the genders, in the sex, the biological sexes, and how we respond to stress?
Well, I think what you just described is forms of coping.
Coping.
And of course, there's maladaptive and adaptive coping, or healthy and unhealthy coping. And obviously, that scenario where the female CEO is reaching out to the other women in the office and socializing, well, that's healthy coping. If the male CEO is once the office has left for the day and he's the only one in his big office, and he brings out that bottle of scotch,
that's the study.
That's essentially unhealthy coping, right?
What are here we have does how you react mean something over the other? Jamie, give us some more details on your question. And I want to come back to this one. So you had mentioned denial.
Mhm.
I want to talk about denial. I see when in my language, when people are, their body is dissociated from the mind, when there's no connection, no relationship, that dissociation, I see a lot of physical ailments coming from the mind denying that there's an issue. So, for instance, a lot of anger in the body and not dealing with the anger creates distress typically on the liver and other areas of the body. Do you see any correlation with the mind and the body that link back to denial? Or any response to, like, what are you seeing with regard to denial and denial of the whether it's emotions, trauma, reality?
Well, I mean, you look at any negative event that occurs in your life, it's going to have a negative energy attached to it, and it's going to project in your direction. And if you acknowledge its presence, it dissipates. It's like a bully. The bully only bothers the person who is reacting negatively, right? And if you act like the bully's not bothering you, it's just kind of, the power's gone. And you have to treat this the same way. If instead of confronting it as it comes along, you end up not even acknowledging it, and it still flew in your direction, whether you acknowledge it or not. It's now internalized unconsciously, and it's not being addressed. It's sort of gathering into a ball, like blowing air into a balloon that eventually pops. And that's why when we get a lot of these people with explosive tantrums or explosive crying spells, and they're like, boy, this is so excessive to what actually caused it. And it's because they're not making the connection that it wasn't that tiny little event that was just the straw that broke the camel's back. It was the accumulation of several events that weren't acknowledged that just kind of seeped out at once, like stuff falling out of a closet.
So Jamie's question is do you see a difference? Does the type of response mean something different? So those that freeze, those that flee, do you notice any patterns in the choices of response?
Well, yeah, I mean, to some extent, the brain makes a quick assessment of your chances of success in either route, right? So if you're a WWF guy, you're probably going to fight because you feel that you could take on that person in front of you. If instead you're a female that's 98 pounds and you're being overpowered by a 190-pound man, chances are you're going to freeze.
Yeah.
It's a variety of things. It's essentially a combination of what the threat looks like in the immediate moment, but also what you're predisposed to doing in the first place. Because remember, this is a form of conditioning. So if for a while now you've always tended to just freeze, then no matter the seriousness of the current situation, you're going to default to that because it worked in the past.
Yeah. So with freezing, do you notice those that freeze, if there's certain types of trauma that are more prevalent? So for instance, like females, my guess would be more sexual in nature to default to freezing. Do you see any patterns?
I mean, you could see it out in video footage of bank robberies. There's some folks that flee. They're either running out of the bank or they're jumping to the ground or behind furniture. You have some folks that freeze. They're clocked out, and the robber might even be telling them, get the hell down, and they're not acknowledging it, right? And then you have the guy who's sneaking up behind him and trying to wrestle the gun out of his hand, right? All of those three are playing out in that scenario. But yeah, certainly the freeze I've seen more often with sexual violation.
Do you have a background in hypnosis?
No.
I am curious to understand how the mind works when there's an external influence. So how, if someone were to be influenced, whether drug induced or, you know, hypnosis, could that cause other unintended side effects? So like severe manipulation or.
Yeah, it could potentially. There's the same effect that I described with the anti-anxiety medication. So remember, it eventually could reach the point where now you're not reacting with stress when you should be. The same thing if you've gone under hypnosis to deal with debilitating anxiety, but then you've come out of that treatment now, not getting activated when you should, and you're having a serious discussion with your partner, and they think you don't care because of that, right? So it can cause complications, yeah. But hypnosis is certainly an interesting thing, and although I haven't practiced it, I have tremendous respect for it. It has similar effects in a way of EMDR, and that there's this sort of rhythmic wooing of the unconscious. So that you let your guard down, and your unconscious kind of leaks out without feeling threatened.
Are you, well, change the wording. Is the military or the Department of Defense as a whole studying the correlation between mental health and physical well-being?
Oh yeah, I mean their model for working with service members is making sure that you're paying attention to and maintaining mind, body, and spirit. The Army has an annual program that focuses on those different dimensions outright. But the Air Force, the military in general, has definitely improved over time on embracing a lot of alternative philosophies on mental health treatment. I mean, mindfulness is very central now, where it was kind of laughed off, only a few years ago.
Huge leaps and bounds on something so simple. So, do you have a simple exercise that we could give the audience, or some tips that we can give them to understand mindfulness in a deeper way?
Well, the purpose of mindfulness is simply to create a state of presence, right? A classic scenario that I see play out with my anxiety clients is they find that they can't go to sleep at night. That's quite often that's a presenting symptom, and it's because they operate like a bullet train throughout the day, because they want to avoid a lot of the negative thinking or addressing things that are maybe unpleasant for them. And so they're just riding that bullet train. And when they hit the bed at the end of the night and there's no more distractions, there's nothing to occupy them, the lights are out, and they're left there with nothing but their minds, that's when that train comes to a dead stop and all the passengers come flooding out, right? When if they just took periodic breaks throughout the day, or little train stops, if you will, and did a 5 to 10 minute mindfulness session, then they have nothing. The train's empty by the time it reaches the end of the line at the end of the night.
Sit on this for a moment. I want to pause on this for a moment, and I want to go divert a little bit and then come back to this. Being that I deployed, being that I was in the military for a while, and then the role that I have here in Nevada as the vice chair for the Women Veteran Advisory Committee for the state of Nevada, I see a lot of data coming through. And one of the pieces is this constant understanding of how people who served in Vietnam may have had no symptoms, retire from their career, and suddenly are having PTSD episodes from something that happened decades ago. And do we know why that happens?
Well, it's usually a combination of two things, maybe one or the other, but often I see both in the same individual. And one aspect of it is their sense of duty is so ingrained in them. Usually by the time they've reached the latter point in their careers, they have subordinates. And they're at the point of selflessness where they want to make sure that any stressful situation comes up, they're taking care of their subordinates before themselves, right? So it's duty first. That's all they have ingrained in them. And then when it's time to reach the end of the line and they can finally focus on themselves for once, it's like telling an android a set of instructions that it can't process, right? The other aspect of it is the loss of sense of identity. You've been in the uniform so long. You've been what your duties are and your responsibilities are and what's expected of you has been made crystal clear. And now you're flung into the civilian world, stripped of the uniform, and you have all of these values that don't exactly correlate with the civilian world. And you're forced to almost rediscover yourself again.
Wow. And then I would assume that that's an expanded version of being busy through the day and then not being able to sleep at night. It's busy through life.
Instead of the course of hours, we're talking the course of decades. Yeah.
Course of decades, right? So how can we stop this train from crashing?
Well,
you talked about simple things during the day. What are some of those simple things?
I mean, for the latter situation where it's occurring over the course of decades, I try to talk to my clients as think of it like a table surface, right? And you've got four legs on the table. Maybe there's more, but each of those legs is an identity. For instance, one leg is I'm a service member. The other leg is I am a father. The other leg is I'm a volunteer with my church, right? And all these legs together are keeping the table even playing, right? But if there is one of those legs snatched away, for instance, I'm no longer a service member, well, that table is still kept level because those other legs are keeping it in place. But if the entire surface is just kind of balancing delicately on one leg, then that disappears. Now their entire sense of identity collapses.
And it feels like all of a sudden this happened, but that wasn't the case. It was three legs fell out and there was no.
It depends. The idea of having as many legs as possible is that in case one identity gets corrupted in some way, then at least you have the other ones to maintain a sense of who you are and a reason for waking up out of the bed in the morning.
Okay, so let's go back to the day-to-day. So the folks that are staying busy, because this is something that I am guilty of too, busy. Even though I'll go for a hike for an hour, I'll still come back and go busy. And then my MO is busy, and then crash because I get a cold and I can't get rid of the cold for 2 weeks because I was so busy for 6 weeks. So
right, yeah, it eventually catches up with you. Yeah,
it catches up. So what can we do?
Well, one thing at the very root of it is that busyness in service of your values or somebody else's?
Oh, wholeheartedly mine. I don't care about other people's.
I mean, in a lot of times in our employment environment, we're servants to somebody else's will, right? We're making money for the company we work for. We have a sales goal, right? You should be doing a lot of your activity in service of your own values. Maybe you can find ways to make the two align, and that's a good way to go about it. But the problem is when we start living for other people is we don't feel the satisfaction that we should from all the energy we're putting into it.
So this is a mom thing. I would guess that moms are guilty of this quite a bit.
Well, I mean, and that's a unique phenomenon too, because if remember we talked about all the legs of your table. If my only leg is I am a mother, and then it's time for my kids to go off to college, then you have that empty nest syndrome, right?
Sarah had mentioned that earlier about the empty nesters. Yep.
Yeah.
So then that really leads us back to that social connectedness. Is staying socially connected, to have the connections in the other facets of our life.
Absolutely. Like one of the most obvious invitations for being so wound up in your children that you go through withdrawals essentially when they have to leave the home is because there wasn't too much going on in the relationship with the spouse. there was some form of intimacy that was lacking, either physical, emotional, mental, or all three. But you were forced to confront that once the children were removed from the equation.
How much does trauma play into the busy, busy, busy?
It's intertwined. I mean, it's not automatically connected, but one way, for instance, what we call them, not necessarily a PTSD type trauma, threat to life, but a micro trauma, for instance, is loss of employment, right? So we were trying as hard as we can in our job, and we were blindsided by being terminated by our boss. And that is a micro trauma potentially for some folks, right? Especially if, once again, that leg on the table is only, I am an employee for this company. And moving forward, you might press 110%. In other words, throw all the coal in that train to the point where it's almost running off the track, just to avoid feeling that sensation again.
Ooh. Ooh. And what usually happens when they just keep throwing coal on the track?
Well, that's a recipe for burnout. Remember? You're not living in service of your values. As a matter of fact, the train's moving so quickly, you're passing all those values by.
Yeah. So I want to ask, before we go, I want to close out with some meditation tips, but I want to see if the audience has any questions for you before we wrap it up. So if anyone has questions, please put it in now. We're going to talk about meditation, then we'll come into the questions, and then we're going to close out, because this is a wonderful session, and I would love to do this again if we can do it in about 6 months.
Yeah.
In let the audience come back in. Yeah, Jamie was saying until COVID, she wasn't good if she had free time to herself. So COVID was a catalyst for I think for a lot of people having to just look at yourself in the mirror and feel the feels.
Yeah. And that's why, once again, that substance use came in, right? Because they couldn't deal with that possibility.
Yeah, absolutely. So I want to close out on a little bit more on the mindfulness and then meditation and the benefits that you see with meditation and the forms of meditation. Because most of us just think yogi pillow, sit there.
Oh, sure, yeah.
That's not the extent of meditation.
Yeah. Well, my favorite is guided meditations. There's a variety of apps, both free and subscription, that really dive into it. And there's different themes. It's almost like going to a Spotify or a Pandora app, because they're broken up into categories, so it fits every flavor. If you don't like one modality, then you go to the other. One thing I like to is walking meditations. I used to take walks in the park, and I found that I had some dedicated space to think about the things that were worrying me, but that wasn't enough for me. You really want to go the extra mile, and you really want to notice the environment that you're walking through, and not just use it as a palette for exploring your negative thinking, right? So noticing the variations in color of the pebbles on the ground, noticing the patches of grass that are maybe a little thinner or thicker, noticing some of the patches in the leaves on the trees, essentially seeing the world with new eyes. And then you're done with that walk, and you really do feel refreshed. And it feels a lot better than if you had, worked out the equations of your problems in your life and maybe had some resolution or idea how to move forward with them. I find that is more beneficial.
Activating the senses.
Yeah.
Are you able to, if people comment later watching the videos, are you able to respond to those comments?
Sure. Yeah, I'll certainly try. Yeah. Oh, and I should, put out the disclaimer, as a member of the military, my opinions are my own. They don't reflect the Department of Defense or the Air Force in any way. Even though, there's psychologists all over the country. We all have different perspectives and, different modalities. And so there might be somebody with, just as much training as me who has a different perspective on something I might have said. And, the field of psychology is the fusion of science and philosophy, right? So it can't exactly be quantified to the point where all of us agree.
If you all were created equally, then we wouldn't be able to solve our problems because we need the variations.
Exactly.
Yeah. Anger is the armor for fear. That is going to be, we're going to use that line in other things on our social media platform.